Hello and welcome to the broadcast. I'm Steve Lubetkin. One of New Jersey's leading community development organizations, La Casa de Don Pedro, is opening a $1.2 million mental health center called Barrio Wellness at 76 Clinton Avenue in Newark. It's the former home of fellow community development organization El Club del Barrio, once a haven for Puerto Rican families and a pillar of support during Newark's HIV/AIDS and drug crises in the 1980s. The three-story brick building has been reimagined to meet one of today's most pressing challenges, community mental health. Its revival marks the next chapter for a site that's long symbolized mutual aid, cultural identity, and resilience for generations of Newark residents. Backed by a range of community supporters, including RWJ Barnabas Health and the New Jersey Department of Children and Families, El Barrio Wellness represents a major step forward in expanding access to equitable care. Joining us to talk about El Barrio Wellness is Peter Rosario, President and CEO of La Casa de Don Pedro. Peter, thanks for joining us on the program today.
Stephen, thank you for having me and to discuss this important topic.
Tell us a little bit about Don Pedro. How did the organization get started and what's its mission?
Sure. La Casa de Don Pedro was founded in 1972 out of community rebellion. At the time, it was really founded to support the needs of back then the Puerto Rican community in the Lower Broadway neighborhood with holistic services, childcare, housing supports, workforce development, ESL, and we've grown to be the largest Latinx-led agency in the state and serve about 50,000 folks annually. Our mission centers on community empowerment, self-sufficiency, and neighborhood revitalization. And our values are justice, love, solidarity, excellence, and belonging. And that guides all of our work.
What was it that made you determine that this was a need in the community to reimagine this community center as a wellness center?
Yeah, I came in during COVID, right? It was the tail ends of COVID, depending on where you were in the country. August of 21, we were still trying to get kids back in school, trying to open back up, getting shots in arms. And it was very apparent when I first came on board that every single, like most CEOs, you have a lot of meetings your first 90 days, and everybody said mental health was a burning issue, especially because nobody could find a provider that was bilingual. So fast forward, we were at a conference talking about mental health, and one of the psychologists who has his own professional practice said, someday I really imagine coming back to Newark and opening up a center at low or no cost if I could find the right partner. And I raised my hand and said, well, La Casa has a building, let's get to work. And soon thereafter, Robert Wood Johnson, I serve on the Beth Israel Advisory Committee. And Robert Wood Johnson's CHIP, right, the Community Health Assessment, their improvement plan, said mental health was a huge barrier. So it was a logical fit for all the parties. And we're just excited to get this, as the mayor said, Lincoln Park is just one of the most historic neighborhoods in the city with a lot of heritage. And it's just a privilege to be a part of reimagining what that looks like for Lincoln Park and for all of Newark.
Talk a little bit, if you would, about the kinds of mental health services you're going to be able to provide to the community.
Sure. We're going to start out with basic counseling services for youth, for family. We can't do preschoolers. That's been the number one question we keep getting asked. We're working on the certification to serve for 0 to 5. But school age, adults, family counseling, all of those kind of traditional behavioral models. In terms of counseling, we're going to do some support groups, some group therapy. So we're looking, right now now that it's open, we're really trying to find out what the appetite is and what supports are most needed. Clearly, we know right now with what's going on in our communities, the aftermaths of deportation, domestic violence always rises during these hard times. And just general family counseling are probably going to be the 3 core programs that we support residents on at this time.
What kinds of professional staff do you have on site at the center?
They're all clinicians, minimally licensed clinical social workers for our full-time clinicians. We're using interns and LSWs. We have a couple of psychologists on staff. We're going to secure a partnership, and through RWJ Barnabas, if someone were to need medication, we have a quick referral pipeline to get them to a psychiatrist if that's the route they need. Because again, we want to fall in that primary and secondary intervention piece. So we want to hopefully get the folks before they require tertiary intervention.
You mentioned the stresses of the immigration situation on the Latino community. Are there any other kinds of mental health issues that are, if not unique to the Hispanic community, more common there than in other communities?
So, it's a great question, Steve. I think the part of the themes when we talk about why do this, and we get back to for us, by us, right? Because I think one of the things, it's not so much that we have different. I think everybody, don't care what your skin color is or what your ethnicity is, faces the issues. But the barrier for a lot of Latinx families is, quote unquote, you don't want to spend 3 sessions explaining yourself, right? If I have to explain to you what certain phrases mean or what it means, it kind of cuts down on not having to feel like you have to explain everything you do in the context. So that's why the Liberation Health model has that triangle of talking about cultural, individual, and systemic issues, because that's one of the things we want folks to begin to understand, that I think like everybody, when something is wrong or when we're feeling down, we look inward and blame ourselves. And what the Liberation Health model says, hey, listen, let's take this going on and put it into the cultural, systemic, box that it's in, and let's unpack that so you understand that the reason you're here today isn't your fault. It's because we have systems that have not been created to support our community. And I think that applies for all folks of color, right? So one of the things from the beginning, we talked about our Black community, the increase in West African, Nigerian. We have a lot of Haitian, Jamaican right now with the hurricane. There's a lot of communities of color and a lot of immigrant communities that need support. And I think that's where, we're at right now.
Now, I know that Don Pedro's area of operation is primarily Newark. Are you hearing from similar community development organizations around New Jersey or around the country that are interested in this kind of model?
Yeah, I think some, Suffolk and Morris County has been doing it for a while. I think we're the first, at least locally, a CDC that's kind of taken this on and added it to its a portfolio, because a lot of the folks who do behavioral health tend to be, it's an extension of medical services. But yeah, I think we're all wrestling with trying to figure out the unique thing that CDCs have, whether it's us or ICC or Clinton Hill Community Action, right? We're in the neighborhood, so people know us. So it's a lot easier to come to somebody and say, hey, I need help. I think we're lucky that we found it was the perfect storm. We had clinicians that were available. We had a vacant $1.7 million building, and we had funding from a healthcare system, right? Those are 3 pretty major barriers. So when we talk about the perfect storm happening in a good way, this is definitely it, right? That we had all the ingredients right at the table. I think at one point early on in the planning of this, I was in the room with 7 clinicians at the time. And I said, I don't think I've ever been in the room with more than 2 clinicians of color. So it was fascinating to sit in the room and say, wow, this just having all of you at the table to talk about this is an accomplishment of itself.
What, Peter, would be the message you'd want to convey to people around New Jersey about the services you're providing and the role that you play in the community?
Get help. I think these, I say it to my staff first and foremost, and these are definitely weird times. There's always been weird times, but these are ones where it's just, we need to be helping each other more, right? Each one help one is the general theme. So get help. Talk and organize in your community and see, right? Even something as simple as a support group. Like that's what we first initially started doing when this, and people said, nobody's going to come to a support group for deportees because they're afraid. Well, they came in droves because they really wanted to talk through some of these issues. And And then call us and reach out for help. And if there's any way that we can support you, right, La Casa already is a regional. 22% of our folks come to us from outside of Essex County already. So definitely, if you're in the northern part of the state, you certainly, people know where to find 23 Broadway. I think a lot of folks, and 39 Broadway, a lot of folks, it was kind of like their first stop when they came to this country. So they certainly know the name and the brand, and we're just here to support them.
Well, it sounds like a very worthwhile project, and we appreciate you taking the time to talk to us about it today, Peter.
Great. Well, thank you, Stephen, and appreciate you helping us get the word out about this.
Peter Rosario is the president and CEO of La Casa de Don Pedro in Newark, New Jersey. If you want more information about La Casa de Don Pedro, you can visit lacasadedonpedro.org. That'll do it for this edition of SBN Newsmakers. If you have comments or questions, please email me at steve@statebroadcastnews.com. For all of us here at State Broadcast News, thank you for joining us, and we'll see you out there on the net. Take good care.